how effective it was in those countries. I think that's my only question, Busi. Thanks. Let me take a couple of hands and then we can move to the second round. For some reason, I'm not able to see hands. I'm not sure if there are any hands so far. Hannah, please assist if you see any hands, but I'm not able to see any hands. Uh, any hands, colleagues? Okay. Busi, maybe for this one, okay, I see Megan's. Yes, please come through, Megan.
Thank you very much. If you can allow me to keep my camera off before I proceed.
Yes, yes, please.
Thank you very much. So it is Honorable Megan Chauke Adonis, member of the National Assembly, representative of the African National Congress. Let me start off by, first of all, appreciating the platform and the space that has been created and also the presentations that have been given to us, but also in terms of the reflective analysis on the data, and I think that's quite important for us to look at it from a clinical and technical point of view, and then also have an understanding from an impact personal base point of view for us to really understand what the data in essence truly reflects and the impact. My questions actually would be centered around, when I listen to the presentations, it does make reference to a particular sector, which is a sector that I fall part of, which is, the disability sector, but it does not explicitly speak about the direct programs or initiatives that are put in place, mitigating initiatives or programs that are put in place to specifically target persons with disabilities, whether you're speaking about adolescent education on reproductive health, whether you're speaking about access to, menstrual hygiene, whatever it may be, safe sex, etc. It does not have, I'm not hearing or I'm not getting a sense that we have gotten to a point of having segregated data or having the appreciation of saying, where does this particular sector perhaps fall off? And the reason why I'm asking this is that what I've analyzed within special needs schools is that on issues of reproductive health is not a priority, and therefore children with special needs in terms of reproductive education are always left behind. And there's always this sensitivity that perhaps they should not have that exposure to that particular knowledge and information. And perhaps it's for me just to get a sense and a view of what the research has been around that, what is the views of our presenters as well, if there's anything that maybe, is being done that we might be enlightened to. Additionally, the inclusive nature of the information and accessing facility. Have we done a case study? Is a case study already in place where we are able to see whether this particular sector is accessing this information, is accessing the facilities, it's able to access the products, and are the products, the facilities, and the information accessible to an extent that there is no one that is left behind. And I think second to last, it would be in terms of reproductive rights and health. We do know that the presentation, one of the presentations spoke about having a very safe space of being able to have a choice of abortion or termination, to have a space where you're able to speak about your reproductive health, to consult on various issues. But as persons with disabilities, it is primarily a very uncomfortable conversation because one gets into a public clinic and would indicate that they would like to go for a termination. And the first question that you would then get from the practitioners or from the nurses would be, as a person with a disability, how did you find yourself in this situation? In fact, it is seen as, or the stigma around it is not a positive one. So perhaps the presenters can give us a view or a sense on what type of awareness would they then propose in order for us to mitigate this discrimination that is being perpetuated, but also the exclusion of accessing enabling information and resources for this particular sector, but also ensuring that we are also lessening cases of botched
Thank you, Honorable Member. Let me move on to Honorable Khatebe. Thank you.
Thank you very much, Chairperson. My name is Makosazane Khatebe, Saving on Portfolio Committee on Women, Youth and Persons with Disability. Chair, I would like to thank the presenters for insight, full and informative presentation. The issues raised, particular around SRHR financing, adolescent pregnancy, maternal health and accountability are very important. I would like to make a few comments and ask questions, particular regarding how we ensure that the budget allocated to SHR translates into real services and measurable outcomes in our communities, especially in rural areas. Chairperson, number one, I believe the key issue is that we cannot measure progress simply by looking at whether the budget has increased. We need to determine whether the resources are responding to the actual needs of communities and whether they are producing measurable outcomes. The difference between provinces, particularly the limited investment in contraception and adolescent pregnancy prevention, require closer parliament oversight. I think the parliament must do more work rather than to pass policies than to do the actual work on the ground. How can you strengthen the budget processes to ensure that SHR prioritizes are clearly reflected in departmental budget lines, properly funded, monitored, and linked to measurable outcomes, particular for women, young people, and vulnerable communities? In closing, Chair, I think the departments that are responsible, they must take this project for SRHR seriously, and we must assist. We must do, not even assist, we must do what you're supposed to do. Thank you very much, Chairperson.
Thank you so much, Honorable Khatebe. Are there any further questions, colleagues, for now? Okay, I think we can take this as our first round. I just want to also, maybe it is not a response as per se to, I think the first inputs that were given by the Honorable Member around data. Yesterday there was a story that was shared with us of, and I just want to highlight the difficulty of collecting and having that data for us to make decisions and to help also parliamentarians to make decisions. A story was shared with us that if, for instance, you have someone going to a clinic, and when they get there, as I think, as they get there, then they are turned away, or they are worried about the confidentiality of their information. Perhaps the rural clinic where most people know each other, and they are worried that what they are going to be sharing with that nurse, who's a public servant, might be shared with everyone else, and then they turn away, they go back home. The tricky part that becomes an issue here is because that person has turned away from the clinic, to record that, to have that as part of data collection becomes difficult because the person did not sign in the clinic, they turned away. So it was one of the things that was raised, that we need to find a way in how do we collect that data when someone is not served at the clinic at that level. So I just want to highlight that we did speak about it yesterday, about the difficulties that we are facing as research institutions that are trying to collect data so that we enable Parliament to make decisions as well. But also we spoke about the rich data that is collected by CSOs as well. CSOs did indicate to us that they are on the ground and they collect a lot of data that people share with them, and they are able to distribute that data, produce that data. And I think we then resolved that it would be important for us as also knowledge production institutions to collaborate with the CSO so that we are able to get that data that comes from the ground. So I thought I should maybe address that question, speak to that question around data collection, that it is very a bit difficult for all of us. But I think we have to collaborate more. We have to do more with CSOs who are on the ground and collecting that data so that we all have that relationship where we share that data. Busi and Hannah, maybe let me allow, should I start with Hannah? Okay, Hannah, please come through.
Thank you. I thought I would just touch on some of the less finance-related questions before I let our subject expert, Ms. Sebeko, speak more to the budget. But maybe just to follow up on your comments there about the importance of data. Of course, budgets and finances are only one measure of the political will behind a certain cause, such as SRHR, and only a partial indicator of whether there is progress and commitment. So as you mentioned, the data really does play such a crucial role here, and civil society organizations are able to fill in some of the gaps there by being more rooted in communities and actual healthcare facilities, being able to collect more qualitative data, speaking to what actual experiences are among people seeking care, what their perspectives and attitudes are, even looking at healthcare workers, for example, what are the rates of conscientious objection, and that helps then to speak to this issue of people being denied care or turned away, which might otherwise not be reflected in the data we routinely collect. But I wanted to speak more to the comments from Honorable Adonis about disability. I'm glad that these were raised. We have there is quite an overall neglect of people with disabilities in health in general, but I think particularly within SRHR, and this is perhaps linked to these paternalistic attitudes that may be displayed when discussing people with disability, the assumptions that people with disabilities cannot be sexual, they cannot enjoy relationships and romance, a bit of a perhaps in an extreme form infantilization, or regarding people with disabilities as children, in the extreme sense. So reproductive needs of people with disabilities do tend to be overlooked. There's one aspect of it, which is physical inaccessibility, actually being able to get to a clinic or to a healthcare service in order to receive the care that one needs. Might not have something as simple as a wheelchair ramp or other accessible forms of communication in clinics or schools, such as Braille or auditory information for those who are blind. There are attitudes, like I mentioned, this more paternalistic view of people with disabilities as people who are asexual and do not engage in any kind of relations and therefore do not need these services. This is a myth, this is incorrect, and it needs to be addressed. Everyone has a right to these services. They have a right to enjoy relationships. And more broadly, there's also isolation among people with disabilities and lack of support in order to actually be able to fulfill their rights and access information and services. So thinking about responses here, of course, we need better enforcement of constitutional protections, including the right to information and bodily autonomy. So infrastructure is one aspect of it, being able to improve that infrastructure, both physical infrastructure and information and education, conducting audits and oversight, and also looking at these attitudes among healthcare workers and teachers. Having more training and awareness raising and stigma reduction efforts would be really important. And yes, I think lastly, I mentioned already the importance of having accessible materials and information available so that people of all abilities are able to pursue SRHR. Thank you. I'll hand back over to Ms. Sebeko.
Thank you for all those questions. I think these are all critical questions about this. I think really what I want to start off by saying is that our analysis of the budget trends is really not to comment on necessarily. We didn't look at the outcomes per se. And I think what's important about the data is what's happening to the budget. I mean, we know there are going to be more adolescent young people, right? And so the question is when the allocations are declining in that arena, what is happening? Is it because people are not using? And I spoke about use versus access, right? So you can provide abortion facilities, but it does not mean that those abortion services will be utilized. And so I think particularly in SRHR, you need, and as Hannah's already said, the data, and as well as Staviso said, the data really, you need more extensive data to really understand the full story. And I think to kind of add to that, to say, for example, when we see maternal mortality, right? There's a set of things that are required. You need a good hospital, you need good doctors, you need good gynecologists. There's a set of facilities and services that are needed, and therefore it becomes difficult to say SRHR where the issue is going wrong. Is it their location? Is it because the hospital wasn't built, which then becomes an infrastructure and a health question? And that's a very different way of analyzing the budget versus saying in this particular program, which is talking more to the services within that program, have failed. So I think to also add to, I suppose, our limitations, to say that the interrelatedness of the health systems, of the education systems, of the teachers themselves, of the doctors themselves, and all these other things are not necessarily added here. We haven't, added how much South Africa spends on gynecologists a year across board as what would necessarily be considered. So I think those are the complexities of the data and the story. And I think the question about gender responsive budgeting and implementation, I think, we don't have many good examples globally of where countries have successfully at a large scale implemented gender responsive budgeting, but we do have examples of countries implementing it at a program level. And so I think, with gender responsive budgeting, it talks to both things that Sabiso was raising about the outcomes and so forth. And I want to read you a quote by the Department of Women, Youth and People with Disabilities, and they wrote this already. It was already in 2006. And this is how the Department of Women and so forth were saying, how should we go about it, right? And it says a general gender budget statement summarizes how the measures in the budget are intended to support gender equality priorities, together with a progress statement outlining the government's progress in supporting and resourcing high-level priorities and goals in relation to gender equality. It may include gender allocations report informed by budget tagging of spend-related data, which helps stakeholders identify the quantity of financial flows allocated to policies promoting gender equality. And it may include a gender impact analysis of specific measures or of the whole budget, which are assessment of distributional effects of the budget within genders. So I think, when we think about gender responsive budgeting, it's a question of what are we trying to tackle? What is the issue, right? You begin with the issue. The issue is that currently abortion services in South Africa are not utilized. Then the question is, okay, how do we plan to address this? And then you say what the program areas are, and then how do we then plan to allocate to this? So it kind of goes the other way, as opposed to what services highlighted, the incremental budget. It actually begins with the problem and ends with the allocation. And then the outcomes and impact assessments are done after that. And then those outcomes assessment are the ones that inform future allocations to those programs. So it's a different logic to how you would budget. And I think that's one of the challenges of implementing gender responsive budgeting at a large scale across programs, across every budget item. And of course, SRHR would then be part and parcel of this, because then there'll be specific SRHR outcomes that we're looking to affect. But I think what gender responsive budgeting helps as a tool is really to assess the issues. And I think the Honorable Member is talking about, we're talking about people with disabilities. We're talking about intersectional identities, right? And how do we tackle that? But if we begin with that problem, the problem is that like Hannah was talking about people with disabilities seen in a particular way from a sexual orientation front, we begin with that issue. What is the issue? What do we need to address that issue? So we need more educational material that addresses sexuality from all types of able-bodiedness and bodiness. Then we begin to then think about the allocations and programs a bit differently. I also don't want to sound too negative. I do think in terms of the Department of Health and all the other sectors that are involved, I'm sure they've got their rationale for why they allocate the monies the way that they do. And of course, we are not necessarily privy to those discussions. And as to take this moment to remind everyone that, of course, the money comes from national and a lot of the spending is done at the provincial level. And in provinces determine how they allocate the funding. It's not like it's ring-fenced. We don't have ring-fenced SRHR funding. So at that point, how budget decisions are made at a provincial level is also a different ballgame, which means that they're being made with reason. I'd like to think that there are specific reasons why the allocations are the way that they are. And I think for members, what's important for me is to, for example, when we look at the numbers and we're seeing declines or massive increases, either or stagnation, the question is why. And I think that's kind of the information that we need to be able to take some of these issues further. And lastly, to just say, the story changes. I think especially when it comes to SRHR, things change, right? So for example, now we've got the HIV prevention, injection. That's going to change how we might be spending on HIV and AIDS in the future. For example, we might have more access to contraceptions, which means maybe there's less abortion. So the data in SRHR does change more frequently than in other sectors. It's not as stagnant. We can't base it based on how many adolescent children there are or how many men, and cultures and societies change. I just recalled when the Minister of Health was talking about circumcision, and one of the things that he was discussing was the relative cost difference between circumcision in the private sector versus the public sector. And so when you take into account those amounts that are happening, and then look at how many people are accessing the services, it could be that in one year you've got sufficiently more people coming in for that service than in other years. So I think these are kind of the nuances that we would need to unpack more about how allocative decisions are made for SRHR. Thank you.
Thank you, Busi. I just want to touch on something else also that I forgot to speak about that was raised by Honorable Chauke Adonis. One of the things we realized when we were discussing this yesterday was that not all problems that could be solved through legislation that actually we have. And I think Honorable Chauke touched on this, that what tools do we have, what tools can we use to address some of these challenges? And one of the things we discussed yesterday was the importance of education, going out there and educating our citizens, especially in relation to their own rights as they compete with other rights as well. I think a good example that was made here was the rise of this notion where people exercise whether it's their religious rights or their social rights, cultural rights, and so forth. And in that exercise, there is that perception of, or maybe there is that notion of infringing on some of the other rights as well. And the idea, the discussion was around that legislation might not be the most effective instrument in that, if that is the case. And what you could use in this case is the leg of where you educate the citizens. And we really need to start exploring and start strengthening those tools that we have as Parliament as well. On to what extent do we go out there and educate citizens about their own rights in relation to other people's rights as well? when you have these competing rights, and it's all these tools that we have at our disposal and how we utilize them. I thought I should touch on that because I think Honorable Chauka has touched on a very important point on what do we do as Parliament, what tools do we have, and what can we do to address some of these concerns. Colleagues, I don't know if, let me take the second round of questions if there are any questions before we move on to the next speaker. Are there any questions? Yes, Gugu, please come through.
Good morning, colleagues, and good morning, honorable members. I just have a question when it comes to how we fare with other SADC countries. I remember that there was a SADC conference where this was discussed. So in comparison to other SADC countries, how do we fare when it comes to spending on sexual reproductive rights? Well, in its comparison with other developing countries in the SADC region, because there are countries such as Botswana, which are developed in comparison to us. So yeah, that is my area of concern. Thank you, colleagues.
Thank you. Busi, are you able to answer that? Have you done any
Yes.
research on this?
I
Okay.
mean, I can give a high level answer. So the things that we learn when we went to this conference, I think one, of course, South Africa on a numeric basis will be spending, because one of the comparative areas was on health. And because remember, our data set wasn't complete in terms of provincial and national amounts, but this was the same across a lot of countries, a lot of other researchers, parliamentary budget officers, everybody was also saying that it's very difficult to isolate SRHR spending. So those quantums aren't really comparative, right? But we do know that South Africa does spend in a total quantum more than other SADC countries. But I think as a share of our budget, there were countries that had slightly higher expenditure as a total of budget. I think what is also interesting in the SADC region to note is also that we don't all share the same policies. For example, in Zimbabwe, abortion is still illegal, right? So there won't be an allocation to abortion services. So one of the challenges in SADC was really a question of we are all agreeing to this SRHR policy as a region, but then within the region, there's still heterogeneity around the policies that support SRHR. So that is one area that also drives the difference in spend within the region and allocations towards SRHR. And then I think the last one was also one of the things that at least I learned is really how fragile other countries' budgets are around health, especially with the PEPFAR withdrawal. And of course, South Africa is also impacted by the PEPFAR withdrawal. But for other countries, they really do rely significantly on donor funding for their healthcare sectors. So one of the presentations, I think it was Mauritius, one thing that was evident is that their health budget changes so significantly every year based on donor funding. So they're not like South Africa where we can say we know that X amount was this year and likely it's going to be incrementally increased next year. And this is the 3-year medium-term expenditure framework. They don't have that kind of budget framework, which allows for steady and predictable funding towards health in general. And I think the last point, and I mean, there's many things that we learn about other SADC countries. I think the other last point is really a question, and which I actually wanted to mention in my previous response, is that part of the challenge with SRHR is that government, the Department of Health and departments of health across SADC will tell you that they are worried about different types of different types of pressures, right? So we know currently in the DRC that Ebola is the current crisis. So of course the allocations towards SRHR are not going to be the same as usual. One of our colleagues from Mozambique was talking about how the continuous climate disaster challenges that they're facing, especially the flooding that has happened, has impacted how the budget allocates towards health and other areas of the budget. And so I think for some other countries, and not all in SADC, it's really understanding the fragility of their budgets in the face of other pressures and in the face of not having, I'm trying to find a word, but the economic, I'll call it economic sovereignty that South Africa has, or steadiness, stability, budget stability that South Africa might have that other countries don't have. And so with and I think just as a last example to say that in Mozambique, what they highlight is that because of the flooding, they've actually lost some of the people who are on SRHR programs, so especially the HIV and AIDS programs, because people are displaced, so you are unable to track the people. And I think with our current context in South Africa, of people exiting the country, that is probably going to be a regional crisis about how do you track, I'll say exiting, forcibly exiting, but it's going to be a question of how do you track people who are part of programs regionally, particularly HIV and AIDS and so forth. So yeah, just to say that I think South Africa fares quite well on a policy level. We do have the comprehensive policy package. And also from a financing, we do have more steady and obviously as a quantum more funding towards our SRHR programs that other countries in the SADC region do not have the privilege of having.
Okay. Thanks, Bosi. Are there any further questions, colleagues, before we take our 10 minutes break? Okay. I think, colleagues, we can come back at 1:15. Just be 9 minutes, and then we can come back at 11:15. And then we'll continue with the next presentation from Budget Justice Coalition. Thank you, colleagues. Let's see each other at 11:15. Thanks. Okay. Good morning again, colleagues, and thank you for coming back in. For now, let's hand over then to Budget Justice Coalition. The speaker is Thokozile Madongo, who's a public finance researcher and policy analyst, whose work she focuses on the political and economy and fiscal policy. She does conduct applied research and policy analysis in budgeting, gender responsive budgeting, and care economies. Please welcome her as she takes the podium. Thanks, Thokozile. Over to you.
Yeah. Good morning and good morning, honorable members. Thank you so much for giving me this opportunity to present before you on sexual reproductive health rights, a critical topic for both the country, but also as a woman in my own identity and the ability of the choices that I've been able to make because I've been able to access good quality care. And so it's of utmost importance that we also center ourselves in this conversation, as has been done by the honorable members so far. I'm going to share my presentation. Okay. Please, could somebody indicate if they can see the presentation?
We can see it. Thank you.
Okay. So I'll be representing the Budget Justice Coalition. I'll say a little bit about them. And the presentation is on gender responsive budgeting and appropriation for sexual and reproductive health rights in South Africa. So I am going to focus in on South Africa as the main example of the work and thinking that the Budget Justice Coalition has been doing. But we have engaged internationally on this issue, and we have engaged on the two budget gender statements that have been presented. So I'm going to talk a little bit about give an introduction and background. Then I'm going to take us to an area of work that I think is critical for honorable members to engage in, and that's gender responsive approaches to macroeconomics. So what is the role of parliamentarians in engaging in the fiscal framework for sexual and reproductive health rights? Because often it is important for us to look at the detail, which Busi provided in terms of the allocations at a provincial level, but there are some important questions about the size of the cake in order to know what we can give to sexual reproductive health rights. And so we should be engaging from a gendered lens. What are the big questions around revenue, debt, and so forth that determine what is available to health, what is available to social development, what is available to basic education, and so forth. And then I'll touch a little bit on our own analysis of budgeting and appropriation for sexual and reproductive health rights, giving the South African example and a little conclusion, and then we'll break for Q&A. So the Budget Justice Coalition is a coalition of civil society organizations that aims to collaboratively build people's participation in and understanding of South Africa's budget and planning processes. And we're a people-powered coalition fighting to make public money work for public goods. So we are on the ground, we do provincial-wide engagements, we do national engagements, and we've been involved in many of the engagements with National Treasury, with the Department of Women on the issue of gender responsive budgeting. And we're made up of over 20 organizations, and we have been very active over the years in making submissions to Parliament on the appropriations, on the fiscal framework, and so forth. I wanted to start our conversation with a little bit of a provocation, which when we are talking about gender responsive budgeting, and many of the feminist economists who engage and talk about gender responsive budgeting, they talk about it being good budgeting. So we often get confused with the gender responsive or women's budgets or whatever we want to frame it. But many would argue that what we're really talking about is good budgets. And so the provocation for the honorable members this morning when talking about sexual reproductive health rights is what values should our economy be built on? And we would argue as the Budget Justice Coalition that our economy should seek to reduce inequality for everyone, men and women alike, which is then the gendered lens to our work. And it should recognize underpaid and unpaid work that is mostly carried out by women, and should recognize care work, or as some would talk about, the care economy, and the role that the care economy, which sexual and reproductive health rights fit squarely in, is predominantly done by women as nurses, as teachers, as mothers, but also interacting with the role of men in responsible caregiving and so forth. So we need to have these conversations about how care needs to be recognized, as well as remunerated and rewarded in appropriate ways, and recognizing the importance of that as impacting and influencing our economy. So I've situated financing for sexual reproductive health rights and policy and budgets within the universal health coverage arena. So, looking at broadly what kind of health system do we want, as well as the interacting intergovernmental relations, interdepartmental relations, and concurrent functions between basic education, social development, and so forth, as has been outlined by the previous speakers. It is an intersectional and intersecting factor. But overall, we want a health system that is financed to enable people to access services free at the point of access. And so we want a primary healthcare system that really drives at a community level the ability to talk about what it means to have a healthy society, but also what it means to ensure that women and girls have a right over their bodies and bodily autonomy, and have access to resources. And again, as the Honourable Member mentioned, from an intersectional lens, we also want to talk about race, class, disability, and all of these things impact on what kind of health system for sexual reproductive health rights, and education system, and social development, social protection system we are providing. So many of the honourable members are familiar with what gender responsive budgeting is, but I wanted to just go over it very, very quickly and briefly. It analyzes the government's budget and appropriations for its impact on women and men, girls and boys. Ideally, it goes beyond simple men, boys, women, girls, to look at location, age, race, class, disability, and so forth. And the mandate derives from multiple instruments at the global and regional levels, including the SDGs Agenda 2030, the Beijing Platform, CEDAW, and so forth, the Agenda 2063, the AU Gender Strategy, the Solomon Declaration, the SADC Gender and Development Protocol, and importantly, our own South Africa's Gender Responsive Framework. It's a long name, the GRPBMEA framework that was brought in 2019. So what is a gender responsive policy analysis? It goes beyond words on paper. It checks whether money is allocated to implement the words. So what those of us that are in the budget justice and budget advocacy arena, we argue that the budget, the fiscal framework, is essentially the policy of government stripped of all rhetoric. So we can see exactly what is prioritized and where in relation to following the money. So it might be nice that we talk about prioritizing sexual and reproductive health rights, but if there's no money put behind that, we know it's not going to happen, and it's not a priority of the state. So we check whether money is allocated. Is there money? And that Busi did a great account of where the money, how and what, and the complications and complexities of trying to track sexual reproductive health rights from following the money perspective. We also want to check whether the money is spent as allocated. So again, we talked about this with the previous input. And we also check who the money reaches. So you might have a program that is supposed to be reaching young girls, but is actually not even getting to those young girls at all, and is getting kind of blockages that prevent it from reaching its intended outcome. And it also checks, importantly, whether the money changes bad, in scare quotes, gender patterns in society. So are we actually using the muscle that we have as Parliament to leverage resources to actually shift gender patterns in society. Because if we're just perpetuating gender patterns, then we're not really moving the needle on equality, inequality, and equity, and addressing gender-based violence, gender-based discrimination, and so forth. So the budget is the most important policy of government because without money, no policy will work. So there are three categories of gender responsive analysis: targeted gender-based expenditure, women, so looking at women's health programs, special education initiatives for children, and so forth. We can look at equal employment expenditure on government employees, so looking at, are we providing childcare facilities, those kinds of things. And then general budget expenditure assessed for impact on men, boys, women, and girls, and intersectional analysis. And this is essentially what we are doing here today by asking the question around what is the state of sexual reproductive health rights in South Africa at the moment, and what does the budget have to say in relation to those expenditures, and is it reaching those who need it, and asking questions of, for example, who are the users of contraceptive services? Are they able to access those services? Do we have the human resources to enable the provision of public health contraceptive services, and so forth? So it's important to recognize that gender responsive budgeting challenges the three category approach, and should it be women or gender? Because if we just focus on women, we miss out on it gives us a misleading picture. So we're not just counting women. We're wanting to count a shift in behavior or the nature of gender relations in society. In the second category, the percentage of pay going to women, it's an important question because a large percentage of budgets is salaries. As we see within our health and social development and education, those are predominantly women-based jobs. And it can be important in countries with strict gender roles. But there's a danger of focusing on relatively privileged government officials instead of poor people in communities. So we don't want to just look at what women receive in terms of income. We want to look at what it is that women across the board, men across the board, are receiving in terms of government programs in shifting gender relations and accessing and addressing sexual reproductive health rights things. Lastly on this, I just wanted to give you a quick outline of kind of what are some of the main questions we ask when we're looking at gender responsive budgeting, particularly when we get ready to look at the fiscal framework, is that do we understand the situation of women and men, girls and boys, and different subgroups, those with disabilities, class, rural, urban, in the sector? Do we have a policy that is gender sensitive? So can we say that the activities that you are approving as Parliament, that the different line ministries will implement, are addressing the situation described? So are those activities enabling people to access termination of pregnancy services, or are children receiving good health education, reproductive health education in schools, and so forth? We also want to check that adequate budget is allocated to implement these policies. So this is the inputs. So are you passing budgets that enable provinces to be able to deliver the human resources to execute the activities that have been identified? And we check whether expenditure is spent as planned. So are we seeing the outputs in relation to that? And we examine the impact of policy and expenditure. Again, always at the fundamental is has it promoted gender equity as intended? So are young women and girls able to make choices about their bodies that enables them to have better economic opportunities, better educational outcomes, and so forth, as by way of example? So this is very similar to the performance budgeting framework used by government. So it's not a completely different way of thinking about the budget, but these are the kinds of questions that we should be asking at a macro level. So is our financing, is the raising of resourcing and the distribution of those resources affecting a public sector system that can deliver sexual reproductive health rights? So I'm going to skip over that. So gender responsive approaches to macroeconomics is that we explore the causality from the macroeconomy to gender. So we've seen that the impact of economic crises, for example, employment impact depends on gendered patterns of employment. So where there are cuts in fiscal spending and higher prices of basic consumption items due to increased VAT or reduced subsidies, this can increase women's unpaid workload and hence their time, labor supply, access to markets and incomes, access to services. So again, it's that there's an interplay between how the macroeconomy works and how it affects joblessness for women or their ability to access wages, and also particularly if we have regressive taxation, it can hurt women more because they tend to be concentrated at the lower end of the income wage spectrum. So when talking about sexual reproductive health rights, we want to look at how tax can contribute to benefiting the poor and vulnerable, which is to look at more direct and progressive taxation than indirect taxation. So our argument is that if you want to ensure that the fiscal framework that you pass every year is gender responsive, you need to look at the nature of taxation itself, the revenue raising policies that are being submitted to you as Parliament to determine whether or not they are in fact benefiting the poor and vulnerable, and particularly women, or are they benefiting the rich and privileged. So again, we look at gender economic gaps. So growth, how growth impacts. So we know that we're in a low growth environment, but there's a role that engaging in gender responsive budgeting at a macro level could actually boost gender parity in labor markets. So the way in which we design our programs, the way in which health is configured and financed can actually boost growth in the economy when we look at social infrastructure. So we don't want to just have a kind of give women jobs alone or smart economics, because we could have women in jobs that are low paid, cheap labor. We want quality jobs, and we want to be able to make sure that we are tackling the care crisis, including the ability of provisioning adequate quality sexual reproductive health services in the country. So we've also seen that the gender distribution of income affects consumption patterns, savings, and investments. And why am I bringing this up when we're talking about sexual reproductive health rights? Well, the income and the employment level of nurses, of teachers who are predominantly women, should be tracked by Parliament. Are we paying them decent enough wages to be able to participate meaningfully in their households, but also meaningfully in the economy? So where you see cuts in wages to nurses, doctors, teachers, social workers, that will have an impact on the economy and will have an impact on the ability of them to deliver quality service, sexual reproductive health services, but also themselves being able to access sexual reproductive health services. So it becomes this very interlinked, interdependent. And so what we call for is a feminist wage-led growth models and policies. So when you're looking at the fiscal framework, and you're interrogating the public sector wage bill, for example, from a feminist gendered lens or gendered responsive lens, if you don't want to use the term feminist, but from a gendered responsive lens, you want to make sure that you're protecting the wages of lower end public sector workers that are mostly women in the very sectors that play a role in sexual and reproductive health rights. So the South African example. So South Africa, as this we've covered, I'm sure, has been talking about gender responsive budgeting for a very long time. We've had some very important initiatives that were driven from 1994 onwards with some successful outcomes. For example, the child support grant is a huge, important win. Our expanded public works programs is one of the most unique in the world in relation to having a gendered component and considering directly what women's work employment issues look like. Obviously, there's room for improvement and conversation the presidential employment stimulus programs with the teachers assistance programs and so forth. So there has been a drive as Busi said, at a program level. And now we've seen 2 gender budget statements published by National Treasury, which the Budget Justice Coalition had been calling for many, many years, and is a good start, but we have a way to go in terms of the quality and the kind of information that both the gender statements present, but we also acknowledge that they are in the early phases of testing, piloting, learning, and developing. I'm going to skip that. So what are the current kind of challenges? So this is just the news. I took the latest news on what the outcome of the budget spending, both at a national and provincial level, what it means just from a health perspective. So I focused on health in this example, but we see struggles with beds and staff shortages. Government spending has stagnated. Sex workers struggle to access contraception and abortion and other services, which is a key sector that we want to make sure are able to receive services. We are facing a healthcare worker crisis. So this gives you an indication of what a needs-based budget would look like if you are interrogating the fiscal framework in October, the medium-term budget policy statements, in October, and you're interrogating the proposed fiscal framework. Are we seeing a framework that is addressing these challenges that are being faced on the ground by, for example, health alone? I could have provided a similar picture for basic education and for social development in terms of the challenges they're facing. So our analysis shows us that over the past 18 years, that our fiscal framework and why a gendered responsive lens to macroeconomy is important is that following the global financial crisis, fiscal policy has shifted towards counter-cyclical stimulus, resulting in a sharp deterioration in the primary balance. So we've got higher debt despite the attempts at fiscal consolidation. And so in this move towards debt stabilization as a share of GDP, we are not seeing growth materializing. And there is a link internationally. The research has shown that by pursuing aggressive fiscal consolidation, you are going to have an experience of a shock in growth, like your growth will be impacted negatively. And in the context of South Africa and the needs, we have to really interrogate from a sexual reproductive health rights perspective, a shrinking or stagnating health budget or education budget or social development for social workers perspective is of concern. So we are likely to achieve debt stabilization after this decade of fiscal consolidation, but we're still in a low growth environment. And we saw that this year's budget introduced the new objective of reducing the debt to GDP ratio, implying that consolidation will continue. So even though there has been this year-on-year promise that once we achieve debt stabilization, we'll be able to then unlock resources to spend in key services, that is not the case and it's not happening. So we're seeing a projected decline in debt, but we are seeing that this is at the expense of expenditure. So what we are calling a kind of secular fiscal consolidation, where this is now becoming a feature of our budget, and we're not seeing an adjustment from a gendered lens for the needs for sexual reproductive health rights to be able to ensure that health, education, social development, and so forth are able to have the right kinds of budgets to be able to pursue the right kinds of policies. And so this has the current policy question is therefore how quickly should debt be reduced and what the implications are for public spending and service delivery for sexual reproductive health rights. That's what we're asking. And that's just a further showing of kind of how core spending over the medium term is going to be reduced, but at the expense of services. So the merits of the gender budget statement, and this is coming to the end, the 2026 gender budget statement builds on those initiatives from 2025 and reaffirms government's commitment to integrating gender priorities. And we welcome this as the Budget Justice Coalition. Unfortunately, the current statement does not adequately assess the implications of the fiscal consolidation path. And this is really what we are concerned from the perspective of providing and dealing and addressing sexual reproductive health rights, is that this fiscal consolidation path that we are pursuing is unlikely to address gender equality and women's economic empowerment. And we see this by the major omission in the pilot exercise of the Department of Health. So it is one of the largest employers of care workers, doctors, nurses, community healthcare workers, support staff. And these jobs are highly gendered. And these decisions about staffing levels, wages, as I've mentioned, working conditions, have direct implications for women's economic opportunities in South Africa. And so fiscal consolidation and underinvestment in social infrastructure are not gender neutral. So when you are interrogating the fiscal framework, remember you are not doing it from a gender neutral perspective. Constraints in these sectors disproportionately affect women through reduced employment opportunities, increased unpaid care burdens, and weaker long-term economic participation, and poorer provision of services in relation to that. So in conclusion, there are other options. A paper that was written by Honorin and Oversight showed that a policy mix of increasing public spending in each of the three categories, care economy, which is education, social development, public public transport and so forth, renewables, by just 1 percentage point as a ratio of GDP every year for 5 years would lead a cumulative increase of 27.8% in GDP and 57% increase in total employment, corresponding to 9 million new jobs. Now, as far as I know, honorable members, the National Treasury is still to present a paper or a policy that delivers a promise of these kinds of results. And here we have an academic paper saying just 1 percentage point increase in spending, as opposed to the current policy, which is a couple of percentage points decrease in spending as a ratio of GDP, is really concerning. And we need to really ask Treasury to give us more examples of the scenarios that they're building and what feeds into these scenarios for us to be able to address the provisioning of adequate quality, free at point of access, sexual reproductive health rights. So we are saying that education, health, social development, and childcare are at the core of the care economy. And investing in care would be mostly self-financing because it could generate revenues. And so we want effective and flexible public expenditure management in health and sexual reproductive health that really consolidates and puts the money where the words are, which we are all dedicated to, which is the rights of women and children, boys and girls, to make choices over their bodily autonomy, their health, and so forth. So, yeah, thank you. I'll leave it there.
Thank you so much, Tobo. Thank you so much. That was quite insightful. Colleagues, are there any questions on the floor? Any questions for Tobo? Okay, let me on my side, and I'm quite happy. Let me be more maybe conservative. I'm glad you raised the issue of fiscal consolidation. We've had fiscal consolidation for so many years, and there were certain assumptions behind fiscal consolidation. And one of them was that once debt has stabilized, then we might be able to go on a growth path. But the economy has not moved to that part for so many years. And it seems as if, fiscal consolidation has become a new normal, I think. Let me put it that way. We have, I mean, from National Treasury side as well, they have argued based on arguments that we can't grow ours. We can't. I think there's a term that is used that we can't buy ourselves out of this problem by creating more debt, and that's how we, and that has been so. There's been that argument as well. I think we still lack a lot of impact assessments, right? To really assess the impact, if we are talking about fiscal consolidation, the moratorium that we are not hiring teachers, what is the impact? Who are the majority of the teachers who are employed? What is the effect of that? What is likely to be the effect of that? If we are talking about government imposing a moratorium on certain sectors, do we have enough sectoral impact assessments that are very clear to say who is likely to be affected if we take this decision? And I think this is what needs to be brought more to parliamentarians whenever these decisions are taken, to have these impact assessments that are data-driven, very clear that this decision impacts this particular sector. These are the most people who are likely to be affected. What is the effect on the economy? What is the effect socially? What is likely to happen? And I don't think we have done a lot of those. And that is what also has, kind of moved given that legitimacy to the fiscal consolidation. I don't know if you have any comment on that. Maybe let me take Zamisa as well. Thanks.
Thank you, Mr. Ptelezi. Greetings, Togo. It's been a long time. Nice hearing from you again. Really enjoyed your presentation, definitely. Same as Busi. And what I'm really excited about your presentation is the manner in which you spoke about gender in a manner that is very inclusive. Because I tend to struggle in most occasions where we speak of gender as if we're talking about one form of gender, because I think that perpetuates the problem, because as you said, men and boys are also part of this issue of gender. And as a man, I really believe that we have a role ensuring that women are empowered. So also the concept of good budgeting, I felt that it was very interesting because I feel like it's very comprehensive and encompassing. It goes beyond just gender, because you can't really de-link the issue of gender budgeting from issues of poor budgeting from the onset, and also the issue of poor spending outcomes, which I think is the biggest problem in South Africa. So I really agree that both ex and post-ante fiscal oversight need to be really strengthened to ensure that gender-based budgeting is increased and issues of sexual and reproductive health rights are promoted. Yeah, I definitely agree with Busi. The withdrawal of PEPFAR funding will have deleterious effects on this subject that we are talking about. So even the issue of the delays in the implementation of national health insurance, I think it causes a lot of problems, because as we speak, about only 14% of South Africans have access to medical aid coverage. So obviously that causes a lot of problems. So I believe that once those delays, the costing of NHI is resolved, the issue of sexual and reproductive health and rights will really, really be promoted. And definitely, I'm really excited about this subject. This was very new to me, so I'm really thankful to all the speakers. Thank you.
Thank you. Togo, you may come through. Thanks.
Thank you so much, honourable members. And yes, I think the question around fiscal consolidation needs to be interrogated. And I think it would be useful for the honourable members to have a special sitting with National Treasury to talk about their scenarios. I think one of the things that we as civil society have been calling for is on what basis are they doing their modelling, and what are the scenarios and impacts that they are assessing when deciding on what they eventually as as the cabinet table before the honourable members in October under the medium-term budget policy statement, and then obviously in February with the budget, because the story of fiscal consolidation is an old story. It is an old promise, and we are being told year on year that we must do more with less. And that is a quote from one of the budget speeches. I can't remember off my head now which year it is, but who is being asked to do more with less? And what does it entail to do more with less? So, for example, for sexual reproductive health rights, it is very difficult to deliver good quality care by producing that with maybe one nurse per 100 patients or whatever it might be. You probably need one nurse per 20 patients or whatever it might be. Health is obviously they would know best, as Busi said. They have a clear idea of what it takes to deliver quality services. But this assumption that somehow money doesn't move the needle is also highly problematic. And so you're right, the saying you can't spend your way out of a crisis. Unfortunately, you do have to spend your way out of a crisis as a government. It's very difficult for a household to do that. But a nation state is within its abilities to leverage both its revenue, its monetary policy, and its fiscal policy, all in line for good budgeting. So you can say, what are the levers within our tax mix that could unlock additional resources before we even talk about raising debt to finance social goods, for example? There's a resistance to do that. And so what are the other options? And we've seen that there is appetite with the JAFECRA unlocking and looking at the entire balance sheet. South Africa is an incredibly wealthy state and has an incredibly good balance sheet. So just focusing in on our debt to GDP ratio doesn't tell the whole story. What it does tell us is that we're not growing our way out of debt, which is another problem. And so something else needs to be unlocked. And Treasury is best placed to provide us with the technical assistance as the honourable members to say, what are the options available to us? And so that can then talk about the stress testing of what different kinds of cuts look like in different departments. So can you expect one teacher to teach 50 kids, or should you be expecting, two teachers to teach 25 kids each? So those are the kinds of questions we need to be asking. But at a macro level, I think the impact assessments are in the news. That is why I wanted to show the stories. We know, and there is research to back this up, that we are not funding our public services to the level that is required to deliver quality and to move the needle on issues of inequality, inequity, and gender-based violence in particular, but also for sexual reproductive health rights. And so we know that our current fiscal framework is not fit for purpose. It is not a needs-based policy. It is a needs-based policy for a particular sector of the society that is benefiting. And so I want us to really, respectfully to say who is benefiting from this budget and who is not. And from there, we can start beginning to talk about how we can do good budgeting for the majority of South Africans.
Okay, no, thanks a lot, Togo. Colleagues, any other inputs, comments? Yes, Anna.
I'm just trying to turn on my camera. Thank you so much. I was wondering whether you could speak a little bit more to that final stage of the budget analysis where you actually go further and look at the real world impacts of budgets and how exactly you think about the question of attribution between budgets and outcomes, given that there are so many other factors that can affect, for example, access to services, how you make sense of that complexity and actually come to conclusions about the effects of these budgets. Thank you.
May I respond?
Yes, sorry. Yeah,
Okay.
I see no more questions. Sorry about that.
Thanks so much, Hannah. So some of it is, and as Busi highlighted, I mean, some of it is quite complicated and complex, and it intersects with much of the research that we've done or engaged with, let me put it that way, from both, the level of basic education, health, social protection, and so forth. And so we've been tracking these budgets over time and seeing and also engaging with community health workers, engaging with in my sector, I've been engaging with early learning practitioners. So, for example, and so we begin to see that when there's deteriorating resources, it becomes much harder for public service servants who have experienced a stagnating income, particularly at the lower end, not at the higher end, but at the lower end. They are under more pressure. There's issues with the morale. So there have been some very interesting studies done in the health sector about what happens when you institute austerity or fiscal consolidation. What happens at a hospital level? We see there's higher opportunities for corruption and abuse because you've got less checks and balances, you've got less warm bodies able to check you. So it makes it harder. So when you have we called it austerity by stealth. So somebody leaves or retires and you don't replace that person. That person might have been really important for checking the invoices, for example, and now that person doesn't get replaced. So there's no one to check the invoices. So corruption breeds in low resourced environments. It actually really blossoms in low resource environments, and the research globally it points to that. So when you have we don't really have a good grasp, which is also to your point, Hannah, of what a good public sector wage or cohort, not wage, sorry, cohort would look like for our needs. So given our developmental needs, what would that ratio be? And so we're just told, and we get given this attack on the public sector wage bill, which is really an attack on the number of public sector workers. What is our best ratio for delivering quality sexual reproductive health resources? Those are the kinds of questions. What we do know from the research, both in South Africa and internationally, when you start cutting budgets, services deteriorate. And employee morale deteriorates, higher rates of burnout. So there's massive research on that, and that then has a knock-on effect of the policies that you're wanting to implement. So it affects teenage pregnancies, it affects the whole system essentially becomes dysfunctional. So and budgets do have a role to play in unlocking those challenges.
Okay, no, thanks, Togo. Colleagues, I think if there are no further questions, I want to thank Togo again for this wonderful presentation. Are there any last minute questions, or we can move to the next item? Okay, no, that's fine, colleagues. Thank you so much, colleagues. I just want to summarize the key issues that we spoke about today as we are getting closer to ending our meeting. So one, we identified that funding remains uncoordinated, and I think also Honorable Dr. Musimaimane spoke about that, about the fact that even cross-cutting issues, it seems as if we are really not at that level where we do this outcomes-based budgeting properly, where we know that all this funding is allocated for this outcome, and everything we know that for this outcome, this is the funding that we are expecting. So it still remains uncoordinated. A lot of the exercises that we have done also on our side, trying to find specific funding for specific items, it was very difficult because it really remains uncoordinated. But also, we did speak about the need for budgeting to have a very strong focus on outcomes, and that could assist in trying to get together all this funding that is cross-cutting in nature. One of the things also we spoke about was how the budget should be focusing on reducing inequalities. And I think inequalities, in fact, and full employment are one of the objectives, macroeconomic objectives for the country. And the effect of some of the decisions we take in relation to budgeting should always be faced with, is this a decision that is reducing or exacerbating inequalities? And then it comes down to whether we're taking on fiscal consolidation or we're saying expansionary fiscal policy. But all those decisions have an effect on inequalities. And there's a need really for us to have those studies that will show what happens to inequalities if, for instance, we decide to increase VAT or reduce VAT. All those decisions that have to do with fiscal, it has an impact on inequalities. And I think as one of the macroeconomic objectives, we should always have in mind that we should strive in a country, especially in a country like South Africa that has high inequalities. We really need to do better in terms of reducing inequalities and use the budget as well to achieve some of those objectives. We also I think touch a lot on using the budget as well to change some of the gender patterns, using a budget as a tool, to change some of the gender patterns. And it's something that we have not looked at as a budget as an instrument, a very effective instrument to change some of the gender patterns within our society. Lastly, colleagues, it's the issue that we spoke about linking performance and spending outcomes and some of the discrepancies. You find that we are spending money, but when you look at performance outcomes, they are lagging behind. And I think we as Parliament, we need to find a way really, for instance, research unit, we really need to find a way of how do we highlight those gaps so that it's clear that in most cases, spending does not necessarily translate to performance in some cases. So there has been those gaps in some instances that we need to highlight and identify what are the reasons why are we lagging on performance while we are still spending money going forward. But colleagues, I want to thank everyone. I'm going to hand over to Honorable Dr. Mosimaiman, who's going to close the session for us. Thank you so much. Let me hand over to Honorable Mosimaiman. Thanks. I did see him here earlier on. I'm just not sure if he's here. Okay, it shows that he's here. Honorable Dr. Mosimaiman. Okay, colleagues, let me thank all the honorable members who participated, who managed to join us. Let me thank also our presenters from CSOs. Let me thank also our own support team, our own parliamentary support staff, researchers, content advisors, and everyone else. Oh, here's Dr. Mosimaiman. Let me hand over to you, Honorable. Thanks. Oh, you are muted, Honorable.
I'm doing my best. I apologize. I just had to step out for a few moments. And what an incredible discussion. I caught various aspects of it as I've been going throughout the day, and certainly listening to the PBO, listening to the perspective from the SADC region, thinking hard about our challenges here in South Africa. Let me firstly, just as a way of closing, thank all the respective role players in being able to put today together. And I think more than anything, some of my takeaways and some of the things that I think we need to take through is to say, without doubt, we must translate policy commitments into really funded outcomes. And when I think about the work that we do as an appropriations committee, often you get National Treasury, and I was catching the previous speaker saying, what models are they dependent on that talk to the fact that this is an economic outlook they have going forward. And I often find that Parliament becomes, instead of being the tail that wags the dog, it just becomes the follower in the discussion. And therefore, it becomes important today that South Africa has a relatively strong legislative and policy framework for SRHR, but often what the discussion has highlighted for today is the gap between policy and implementation. And part of it is that public representatives aren't always skilled enough to figure out how to use what is their legislative ability to be able to amend the budget and be able to put credible budgets forward, so that the political leadership that is elected understands that the tough job that it has to account on the basis of how it has budgeted for this issue. The second takeaway for me is the issue of the HIV response, that in fact it does require sustained and strategic financing. You know, there's no doubt about the fact that I am watching in some aspects of the issue, some of the rise in the number of infections. And whilst we've been able to find some of the, at least even vaccines, etc., the difficulty is that the burden is increasing. It's increasing in communities. It is disproportionate in terms of how it affects young women and girls. So whilst the earlier theme of the day is that how do we help young women make choices about their own bodies, part of it is about ensuring that HIV funding is sustainable, it helps protect, and it helps guide decision making. Thirdly, it's the question about gender-based violence and femicide must remain a budgetary and oversight priority. If we think about it, you know, when I engage departments across the whole of government, all of them are tasked to allocate within their own respective budgets funds that go towards fighting gender-based violence. Yet, often some of it isn't coordinated, some of it is having minimal impact. And we can all agree here today that it has direct consequences for affected beneficiaries, especially for SRHR. So I want to ask that when we talk about the objective vision of producing safety, dignity, and economic participation, that we have to deal with gender-based violence and femicide. We have to attend to it collectively as a society and where we've got to go. The other point I think that certainly has stuck out for me is that we cannot overlook those who experience the greatest barrier for accessing services. The issue of physical accessibility and how we do it, and this is where, when we talk about provincial work and monitoring on provincial budgets, we have to think strongly about whether people can access these rights, can materially access them, and ensure that at least even from a healthcare budgeting point of view, it responds to the question of accessibility. Young people desperately need greater attention. Our population is young, the continent is young. But when we discuss at length about education and how we incorporate young people into the space, it is often in such a manner that young people are stigmatized, and sometimes in certain instances, the education that goes there deficient. And therefore, we have to ensure that there's proper training. We must ensure that we engage young people thoroughly in this matter for them to ensure that we reach the information that reaches them effectively and is able to help them make better choices about their own bodies. Fellow South Africans, I think if Parliament fails at the basic duty of improving visibility and traceability of SRHR expenditure, then we can appreciate that overall the budget system does not respond adequately to the needs of its citizens. And like I opened earlier on today, incrementalism isn't going to help us. We have to, when we take away from this sermon, is that we cannot effectively oversee what we cannot clearly identify. And programs that we put together on the table must clearly identify the outcomes we want to see. We must be able to understand how much money is being spent, where it is being spent, what is needed and intended to address, and what outcomes are needed to be achieved. The last few points I want to make is that fiscal constraints cannot become an excuse for action. And I think I started off this morning highlighting the fact that we can't keep banging the drum about saying, well, we're growing at this level. I listened to the previous research about the 1% adjustment in much better expenditure from a government point of view and what its deliverables would be. The debate can carry on today, and I'm not here to enter into the depth of it, about whether we have fiscal consolidation or others would call it austerity, or what does it mean in terms of expansionary fiscal framework. But I do think certainly in a time such as this one, South Africa's economic expenditure needs to be able to reflect its intention to grow. And whilst many others would say you can only do that through debt, I do think there's some aspects of government that are not delivering the appropriate economic benefit that we need. And therefore, this becomes a question that we've got to put through. Lastly, last 2 points I'll make is that importantly, we have to be reminded that financing SRHR is also an investment into the economy and into our social infrastructure. You cut that, you cut your economic potential. You continue to confine, particularly women, to become the face of poverty. And so for me, for the Appropriation Committee, the message is clear and it is particularly relevant that we must consider the size and the composition of the budget. We must ask whether resources are being allocated sufficiently and that we're able to respond to this particular issue. And ensure that we're transparent in the manner that we go through. I'm walking away from this exercise, and at least today, just with an injunction to say maybe in many ways we become blind to the particular omission or in some ways not the fulfillment of certain rights. We budget as though we kind of keep the same models on the go. And I certainly, for me, from an appropriations point of view, are taking that strong message loud and clearly. From the PBO, I think it's this question has been raised a few times. And now what I'm taking is to say, look, we've got to do more work and ensure that it is reflective of that. So I should say to you, just in conclusion, that it's not just a question of money. It's a question of us asking whether we're allocating sufficient resources to the right interventions, to the right people, and at the right level of government, whether those resources are prioritizing the outcomes our policies promise. So to fellow South Africans, to the conversation today, thank you so much for the valuable contributions that we've had today. I'm deeply appreciative myself, and I'm certainly taking these discussions forward. I know some of our research unit is here. I heard Musa speaking earlier, Mr. Zamesa. And so how do we take some of this conversation to ensure that our next response from a budget point of view, that Parliament is seized with this matter, it discusses it. So thank you not only for holding us accountable, but shining a mirror on how we've operated in the last while, some of our successes and some of our failures. But to Helen and the team and to the research unit of Parliament, I thank you. I genuinely myself, personally, you have enriched me, you have enriched our participation, and I look forward to further conversations of this nature. Thank you very much, and thank you for the session today. Thank you so much. Let's make this a lived reality for all citizens. Thank you.
Thank you so much, Honorable Dr. Maimane. Colleagues, please assist in filling up the survey, and then, yeah, otherwise the meeting is adjourned, colleagues. Thank you so much for attending, and we really appreciate it. Have a good day. Thanks.
Recording stopped.